Hi, this is Rick Farnelli, Madera County Supervisor, District 3. Today we're having a meeting with Madera County Public Health Department Director Von Do-Reynoso. And what we're going to be talking about today is a healthy eating program that has come down from the state. It's a mandated program that Vaughn and her group has really gotten involved with. And there's been a lot of cost saving because of the pre-maintenance issues on some of the people that we're have coming in and dealing with. And it's just like I would say the advertisement, pay me now or pay me later. And so pre-maintenance is always the best policy, and I think her team has done an outstanding job of reorganizing and to help basically pay some of these programs down so we can have more programs with the money that we have. So one of the really good programs that is going on is their healthy eating program and their teen pregnancy program. We have a lot of issues with those programs, and again, they are paid by the state or the federal government. And I'd like to have Vaughn today explain these programs and show the community what we're doing on public health.
Okay.
Vaughn?
So we have several healthy eating, active living initiatives funded both by the state, the federal government, as well as private foundation. Kaiser funds some of the efforts. And so essentially what it is our community health team go out to after-school programs, elementary schools, as well as senior centers, community youth centers, you name it, and we're there. We've been everywhere throughout the county, really teaching people a better way of eating, introducing to people, students, seniors, youth, about different types of food that they typically wouldn't normally have exposure to. And the kids love it, the parents are loving it, the seniors are loving it as well.
Well, the program that I really liked was when I went out to the John Wells Center and the Pan American Center as the after school, and teaching kids how to cook.
Right.
And I understand that they're bringing that back to their parents now.
Yes, it's amazing. I heard from a principal the other day that she was marveling the lifestyle changes that's happening from the student. So the students are going home and saying, guess what, Mom and Dad, I had spinach with strawberries in it, and insisting that the parents try it. I have heard of stories where the students are saying, let's not drink that soda, let's not drink that fake juice, but let's just have water. Let's put some fruit in the water. It'll make it taste better. So we're seeing lives change, and I think that these lives being changed, being impacted, will, like you say, result in a healthier community downstream.
Really appreciate those programs. Tell us a little bit more about the pregnancy, the teen mothers.
We also have several programs in our community health, as well as in our maternal child adolescent health section, where we work with young moms, young families, dads are included, and we call it our home visitation programs, our CalLearn, our AFLP programs, where we work with the families and equip them with tools so that the young families stay in school. Once they graduate, they pursue post-graduation opportunities, college or vocational schools. They're gainfully employed. So really, while they're pregnant all the way to the first, second year of life, we impact that family unit so that they become self-sufficient, so that they can become independent and really live the lives to the optimal that they can.
Now, the healthy eating program is part of the prenatal program also, and so we've basically reduced that quite a bit. And how much does that cost save the county?
So I don't know if you know this, but for every preterm baby, the rough cost is about $56,000 for the first few years of life. This is not including if the child suffers from other medical or social conditions after that, right? So we have in our intensive case management program 0 preterm as compared to 12.5 nationwide. And so that's considerable savings. And then the other really good indicator of our success, of our good work, is that we have 0 repeat pregnancy rates in the programs as well. And that's an amazing stat.
I didn't know that one. That is a good stat.
And so we also have another program in our community health where we go into the schools and we really talk to the young people about taking responsibility for their behaviors. And that is to address teen pregnancy.
You know, the other portion of public health is basically our, disease portion of it.
Correct.
And we had a big whooping cough.
Yes, pertussis.
Yeah.
Yes. Yes.
Big name. But anyway, can you tell us a little bit more about your disease?
Sure.
And
So
how we keep people from getting some of these diseases and how we, monitor them?
So last year, for the same time frame, we had 7 pertussis cases. This year, we have currently 43. So our job is to investigate, to educate, and to really encourage people to get into their healthcare provider and get that booster shot if they need it, get immunized if they haven't had a Tdap shot. And so, as you know, whooping cough, commonly known, is a bacterial infection, and it is transmitted when people cough and there's inhalation. And so it's very contagious, and we're experiencing another epidemic. The California Public Health Department has deemed 2014 whooping cough outbreak as an epidemic. And so we are hard and fast really encouraging parents of 7th graders, grandparents, newborns, moms to really stay up on their immunization.
That's good. The last thing that I want to talk about again is the healthy. I want to come back to the healthy eating program and explain how it is for everybody in the community, not just, it's just like me when I went through my weight loss program.
Right.
I came out here and I asked you guys for help, and you helped me on a situation. But this healthy eating program that came down from California basically is for everybody.
It is.
Not just people that need the help or poor or whatever, but for everybody.
Correct.
And I want everybody to understand that they can come out here.
Yes.
And get that program for themselves. I mean, no matter what position you're in.
That is true. I think, everyone, no matter your level of education, your income, where you're at in your stage of life, can use some additional information on how to eat healthily and how to stay active. And one of our initiatives that we also, I think you have attended a workshop, and it's called the Chronic Disease Peer Management Program. And so we have held classes, it's a 6-session class in various, at the behavioral health department, in the hospitals, at certain physician offices, and it's really a good way to help people with chronic disease to look at what they have from a healthy perspective and how to manage it themselves with the tools that we give them. And that is available to everyone. And again, in terms of teaching people how to cook differently, how to shop differently, that is available. We go to basically anybody that's interested in us coming out and showing them, or we go. We have been to community organizations, after-school youth programs, schools, and we have fulfilled the scope of work by our grantors, but we're always looking for new venues to share the information.
Well, thank you, Vaughn. I really appreciate all this information. I hope the community pays attention to what our public health department has for them and is doing for them to keep us safe. And I really appreciate this interview. Thank you very much.
Thank you.